The CAOT Citation Award is awarded annually to an agency or program that is not an occupational therapist and who is recognized for their contribution to the health and well-being of Canadians. CAOT was pleased to forward the nomination of Handi-care International. The following citation was prepared. Handi-care International is a Canadian charity and key supporter of work done by Amar Seva Sangam, or ASA, a non-governmental organization in South India that provides rehabilitation services to persons with disabilities. ASA benefits greatly from Canadian student occupational therapist fieldwork placements, which increases ASA's capacity to provide services to their community and bring helpful resource and knowledge to the organization. In return, Canadian students on placement at ASA learn skills in sustainable, ethical, cross-cultural practice. Such skills are enormously beneficial to practice back in Canada as students graduate and work with diverse client populations. Starting with one student from Western University in 2005 and growing to collaborations now with 10 Canadian universities, including all 5 Ontario occupational therapy programs, and offering nearly year-round placement opportunities, this is a strong and growing partnership. None of this would be possible without the coordination of Handi-care International, which facilitates all of the logistics for student placements, coordinating student recruitment, preceptor matching, fees, travel support, and orientation. They support students and volunteers before and throughout their trip, and they work closely with Canadian occupational therapy education programs, constantly seeking to improve the student experience. On behalf of Karen and CAOT and OSOT, it is our great pleasure to present this award to Handi-care International. It's our pleasure to have the founder and president of Handi-care International, Mrs. Sulo Krishnamurthy, and board director, Dr. Dinesh Krishna, here with us today. Sulo, I will pass the virtual mic to you.
It's a real great pleasure and honor to be a recipient of this prestigious award from your Occupational Therapy Association. And it kind of endorses what we have been doing and what we will continue to do. Jana and Gio and Jeff Boniface nominating us, and I thank them. And it's a great journey. I hope it continues for a long time. And thank you very much again for this award. And now I pass the mic over to Dr. Dinesh Krishna, who is the Director of Placements, and he knows more about the placement itself than I do. Thank you.
So we are, from Handi-care International, we are extremely honored to receive the Citation Award from CAOT and OSOT. So through this work, I have really come to appreciate the role of occupational therapy has in the healing journey of people with disabilities. So we started offering international fieldwork placements at Amar Seva Sangam in rural Tamil Nadu for OT students. And since 2014, we've had 139 OT students across multiple universities in Canada, 10 universities, including all those in Ontario that offer OT programs, as was mentioned. Students have done placements, OT students have done placements in a number of different areas at Amar Seva Sangam, including spinal cord injury, stroke rehab, community-based early intervention and child rehab programs, special needs and integrated school, and vocational training center, to name a few. And they've worked with children and adults with disabilities. So there's so many individual people's effort that went into making our program successful, and I'm sorry I don't have time to mention them all, but if I could just have a quick minute, I'll mention a few. Jana McLaughlin is an OT currently working in Nunavut and doing her PhD. She first visited Amar Seva Sangam in 2005 and really helped launch this program. In addition, Christy McLaughlin, Zoe Campbell, Gia Boniface, Harsha Babani are all OTs who have been instrumental in helping grow the program. Chamilla Anthony Pillay is an OT that is currently working in Nunavut. She did her placement at ASA a few years ago from McGill and is now one of our main coordinators. I also thank all the OT fieldwork coordinators across the universities in Canada and Ontario, whose partnerships have been very valuable to allow our program to go. Many of them have even gone on to visit our institution in India, including Carolyn Storr, Jeff Boniface, Heidi Lochner, Deb Cameron, to name a few, and I thank them immensely. Finally, as mentioned, I want to thank the staff at Amar Seva Sangam, in particular, Mr. Ramasubramaniam, who is the head rehab director at Amar Seva Sangam and the main coordinator of the clinical placement for OT students. In addition to the 4 OTs and the rest of the multidisciplinary team at Amar Seva Sangam that support this amazing project. So thank you so much, and apologies for taking so much time, but thank you so much for the OSOT for honoring our organization with this award. Thanks.
Thank you both so much for sharing the important work that you do. And again, to represent Karen and CAOT in our comments, we do want to thank you for the contribution you make. May I ask our membership to unmute for a moment and in this virtual capacity give you a round of applause worthy of our admiration and appreciation.
Wow.
Thank you so much.